Welcome to the Nourished Brain Podcast, where we focus on mindfulness-based whole foods nutrition and the art of empowered eating to optimize health, mood, energy, and nutritional well-being. I'm Sarah Fajera, an integrative and functionally minded registered dietitian and owner of Mindfully Nourished Solutions. Let's get you nourished. Christa Biegler is an award-winning dietitian nutritionist, online educator, and host of the Less Stressed Life podcast. She specializes in gut health-related issues such as IBS and IBD, eczema, fatigue, and autoimmune conditions in private practice, and has consulted in a variety of areas, including work with a major food company to behind the scenes for a fitness celebrity. She is the creator of the Less Stressed approach to eczema and Fast Track to Fabulous Food as Medicine programs, and has been a guest on other podcasts and lectures, such as this one. Christa, welcome. Welcome.
Thanks so much, Sarah. It's an honor to be a guest on your podcast today.
Yay. Yeah, so Christa, I really wanted to have you on specifically because I know that you work tons and tons and tons with skin conditions in your practice, food sensitivities in general. And I have in the past, I have directed individuals to your podcast to just try to clear some of the confusion around all things food intolerances and sensitivities and allergies, because out of all the topics, that come up in conversation for me with those I'm working with, I think that's one of the areas where people just really get stuck and are trying to figure out what is going on, what are the mechanisms, why do they not feel well after eating, what tests do they ask for, how do they navigate it, can they make sense of it just with their diet, do they need a test? And so that's what this is all about today, all about trying to just clarify, right, what people are looking at when you're thinking about that whole spectrum of adverse reactions to food.
Right. Food reactions are pretty gray sometimes because, what some people recognize as one word, I think the terminology isn't exactly unified and not everyone is on the same page, lending to even more confusion. So
exactly.
It's not the listener's fault. It's just that, kind of like everything in the nutrition world, this is also could be confusing if you didn't have the right foundational or the right background terminology.
Yes. So Christa, tell us a little bit, just briefly, about your own foray into food sensitivities. What really drew you to start to think about working with them in your own practice?
Yeah. So I actually, I don't know if this is a great story, but I like to say I was interested in gut health kind of when the heyday of probiotics hit. And honestly, who really knows that? I was sitting next to a microbiome researcher from Harvard on a plane one time, and we were kind of talking about the ups and downs of when that all happened. Things really hit the market kind of big in 2009. And I remember at that time doing a lot of research, and there was a lot of crap products coming out with probiotics in them. And at that time, I was really interested in probiotics. Well, then fast forward much, much later in life, after I'd done a lot of other things, I was talking to a fellow dietitian who was working with a dietitian, and she was working through some serious gut health issues. I want to say she had some small intestinal bacterial overgrowth, and she had some other issues, and she was working through some food sensitivities. And I thought, well, this sounds really interesting. It was still related to gut health, which is what had really transitioned. I mean, I think a lot of people think of gut health like bone broth and probiotics, and I think of a lot of other things now. But she was talking about that at that time. It really kind of got me interested in that. And I'm kind of the person where one thing leads, it's all about who you know, and that kind of affects your life. And so I got kind of connected with the right people, did some additional training, and met this entire world of integrative registered dietitian nutritionist, which really positively affected my life because it was exactly what I was looking for, right? The best of East and West, right? Sometimes we get frustrated by everything we learn, and then we can't utilize with clients to really make the changes that we want, to really see the results we want. And I guess I'm so obsessed and results driven that this was just working with food sensitivities was one part are one tool in my tool belt of really accelerating results with gut health. So I guess that's kind of how it went.
So we'll be able to both share perspectives from private practice, from clinical experience about what we're seeing, working with food sensitivities and what happens, right, when people take that journey and really, really dive in. So should we just talk big picture about definitions, acknowledging, of course, that we only have so much time here and we are not immunologists. So my gosh, just to even talk about food allergies in and of themselves, to really do them scientifically rigorous justice, to have a really, really good conversation. It could be days worth, of information. So we're just going to talk big picture here about, kind of what you need to know just to start to make sense of the distinctions. And I think that food allergies are a really good place to start, Christa, because it's what most people might be most familiar with as far as an association between clinical symptoms, anaphylaxis, etc., and then the connection to a food or environmental allergy. So do you want to describe just that term allergy to us? I think there's the least amount of maybe confusion or controversy around that.
Right. So the one thing people say, if you have a food problem in general, a lot of people kind of miss or incorrectly use the term allergy, and more power to them. Sometimes that's just easier, right? Like if you're not really reacting well to a certain food, you go to a restaurant, you just go ahead and tell them you have an allergy sometimes to really avoid, let's say you have actually a pretty significant reaction to that, then that's kind of probably the easiest way to get your point across, honestly. But what is an allergy actually? So allergy is the one thing everyone can agree on. It is an IgE, like elephant, reaction. So what does that mean? It's usually pretty replicatable. This is what your allergist tests for. Basically, a food allergen is coming into the immune system. It sits on a special immune cell, and then all of a sudden that immune cell has a bunch of messengers that go out and say, mayday, mayday, and it might be a sneeze, or it might be like swelling of the throat or the tongue. It might be hives. So that's kind of what a food allergy looks like. It doesn't present always in the exact same way, but swelling of the tongue, throat, and skin issues and hives, those are really common issues with IgE allergies. Those are something your allergist is going to diagnose with either a skin prick test for environmental allergies, but more often by a RAST, or it's actually like a blood test for allergies. So that's what your allergist really recognizes. Now, if it's okay, I'm just going to transition into the difference I see with sensitivities for a quick second.
Because for contrast, please.
Yeah, so sensitivities are where things get gray because a lot of people, including doctors and even dietitians, don't understand sensitivities fully. And some people might use sensitivity as a blanket term for any kind of food reaction because the definitions are blurry. So some people call other types of food reactions either intolerances or sensitivities. And we don't necessarily have to agree on which term completely. An intolerance really, I think you and I probably think of as kind of a digestive insufficiency and enzyme insufficiency, like lactose intolerance, right?
That's
like people can't break down that sugar.
Yep.
Yep, so it's more like how your body's digesting that food, whereas a sensitivity is still an immune reaction, but your allergist might not recognize it as a merited form of a food reaction because they aren't always able to replicate it exactly the same. And so sensitivities can shift a little, and this is where we can get into some interesting pros and cons, but I'll mention really quick. So sensitivities can really vary. I said IgE is kind of like the thing you should remember from allergies because that's the type of mechanism that's being measured, whereas sensitivities can vary a lot, and that's part of the problem is that we don't really agree on the types of testing. And so a lot of things you'll see, like if you're scrolling Facebook, you're going to see a lot of white-labeled IgG tests, and those just look at one other mechanism in the immune system, and then some other sensitivity tests look at many mechanisms because there's IgG, IgM, T cells, et cetera. Like there's a lot of other mechanisms that can be happening, which is why, you can kind of see here's why it's a little confusing. Here's why maybe allergists don't agree. This is why maybe even other professionals that do different types of testing don't agree because it's not exactly uniform, right? But, the most important thing is what kind of results can you get from this and what's it actually going to tell you, right? That's what's important.
I'll tell people sometimes that there can be some overlap a bit in pathways because, for instance, if you think about exercise-induced anaphylaxis, which is more in that allergy camp, even then you have, when the cells degranulate in the course of allergy, there's a release of inflammatory mediators, and you can start to, like you said, see some, issues with skin there, right? But it's, so it even can be kind of contextual when a reaction happens based on what else is going on in the body. So, like you said, there can be, so a couple of main mechanisms, but that people can experience even allergies along a whole spectrum, right? We know that it's, the immune system's really super complex, and that's kind of what it all comes down to. That's how I understand it. At the end of the day is it depends on really how your immune system is programmed to respond to any given food, and the duration of time that someone might be intolerant or sensitive to a food could be different than an allergy because they're different mechanisms.
Right.
Yeah. So when you think about just kind of common signs and symptoms we talked a little bit about allergy, right? So I think you're right. Most people think of anaphylaxis, trouble breathing can be obviously life-threatening, no joke, really serious. What about a food sensitivity? From what you've seen in practice, as far as before and after, right, addressing food sensitivities, what most commonly comes up for you?
Yeah, there's a lot of systems affected by food sensitivities, pretty much your whole body. In fact, the types of symptoms, so I'm going to list off some symptoms, a lot of people wouldn't realize that any of these are related because they seem, the way we kind of treat people is we treat them like a branch on a tree, right? We don't necessarily treat root cause all the time. We're like, oh, well, you have sinus issues, so we'll give you like sinus stuff, and you've got like joint pain, so we'll give you joint pain stuff. So we kind of treat things individually, but really this is part of the whole system of what's going on. So some of the common signs and symptoms, and there can be more than this, would be headaches and migraines, joint and muscle pain, any kind of digestive symptoms. So IBS sufferers really benefit from kind of digging into this. Really sensitivities or inflammation. So I love helping people that have irritable bowel disease or Crohn's or colitis because you can really help affect inflammation. I mean, all these things are symptoms of inflammation, right? Asthma, sinus congestion, skin issues, fatigue. For me, inflammation really presents as fatigue. When I'm less inflamed, I just pop right out of bed. So that's kind of like a really fun side effect because most people don't even think that that's a possibility sometimes, right? Like this whole coffee-driven society, you don't have to be tired. That is not normal. Just because something's normal doesn't mean or just because something's common doesn't mean it's normal, right? So we do not have to be fatigued. Water retention, I just had a guy with rheumatoid arthritis tell me yesterday, pain can kind of resolve slower, but he let me know that he lost 15 pounds these first 3 weeks. Not that he was a big guy, but he said it was just lots of inflammatory water. I said, yeah, it's not uncommon for you to lose between 5 and 10 pounds of water weight, depending on how much is on there that first 7 to 10 days. And he said, that's exactly what happened to me. So gas, another one that we consider common, but is it normal? Like, why do we have gas? Well, it's really a sign of our body kind of fermenting something a little longer. So that's been a really fun one to eradicate out of life too sometimes. Like, oh, we don't actually need to have gas. It's funny what we think is really normal, but it's really not normal. And then just kind of any other irregular bowel things. So this is not always related to sensitivities, but usually they play a role because this is a whole nother conversation on how sensitivities manifest and why they would even cause problems with bowels. But those are some of the common ones. But like I said, it's really an inflammatory reaction. So if you think about anything that deals with inflammation, if you're having puffiness, you're feeling just weighed down, honestly, I think weight can be a side effect or is a side effect of an underlying problem, right? Like, let's say someone turns 40 and then says, I just can't lose weight anymore. Or they get a little older. I had someone tell me yesterday, like, I didn't get allergies till I was in high school. Okay, well, there's issues that are happening in your immune system allowing this cascade to happen, basically. So, yeah, lots of systems involved. I love seeing how many of these issues my clients have, and I always ask that kind of in an initial survey because the more of these you have, the more that you're going to be excited when they all start going away. So that's really fun.
Yeah, it's just hugely satisfying as a dietitian to see. It's like the
Uh,
power of food at its best, right? Working through a really well-informed protocol. The thing that I have
right.
been surprised to see as just a first response, other than the water weight loss, decreases in bloating, is really improvement in sleep. You were talking about fatigue. People come back and they'll say, "Oh, dokie, like, well, I am sleeping better." And often it's not even something that was really being targeted. It's kind of a side issue. But gosh, when sleep
Hmm.
improves, so does everything else.
Yeah,
So does everything else.
your
So
whole life improves.
it's good
Yeah,
stuff.
yeah, your whole life improves. I love seeing that. So that's kind of, I always tell people, or people that have kids with eczema that are up in the night with their child itching. I'm like, so our first goal these first couple of weeks is for, night waking and itching to stop. And then I love when like Crohn's and colitis people tell me that too, because you're exactly right. That's the least of their worries usually when they start. With kids, yeah, we don't want them waking at night. So that's usually something parents are aware of. But people that have had a serious medical issue, they don't even realize how abnormal their lack of sleep. They're just kind of done telling people about it sometimes because, they're not getting any answers sometimes. So
Uh-huh.
it's
Uh-huh.
really fun when that resolves.
Yeah. Yeah.
There's so many neurotransmitters and hormones that originate in the gut, right? We're talking about the immune system, which
Yeah.
is largely inside the gastrointestinal tract, which runs from your mouth to the other end, and is quite large. And there's so many, I think there's like 30 or so hormones that are made in part in your gut. And so, foods and the types of foods we eat can impact the types of bacteria that are being kind of proliferated in the gut. So I think that's one reason that sleep improves. Decrease in inflammation is another reason. And then just overall dysbiosis, which can be resolved in other ways. But man, it's fun. It's sleep. There's a lot of reasons you're not sleeping well. And so it's really fun when that starts to improve too.
That improves, yeah. So, oftentimes what I'm seeing, when people kind of give me a call or drop me a note, is that they've already tried some things usually. So for someone who's been struggling with, gastrointestinal issues, GI issues, stomach issues for years and years and years, often they've tried, pulling things out of their diet, reintroducing them. Many people will say that an elimination diet is kind of a gold standard, right? Where someone can really observe based on their baseline how they're responding to different foods. So, what I see, and I'm interested to hear your perspective, then we can dive into testing and all of that. What I see is that first, individuals often have done really a partial elimination diet more than a really rigorous, well-guided elimination diet where, maybe they've pulled something out 80% or they weren't really sure what to even look for or track. There was still some cross-contamination present perhaps. And so when you think about how reactive the immune system can be, using the example of an allergy, right? Even the smallest amount of an antigen or a food compound could be enough to cause a reaction, whether it's kind of low grade and flying under the radar or whether it's really obvious. And so that's kind of an interesting observation, is that oftentimes, just trying to do it by yourself can be really darn tricky because there's so much to think about. But the other thing,
it's so much.
yeah. But the other thing that I see a lot of is just frustration because people will feel like regardless of, whether something was done 100%, often they've done their best. And so that they can't figure out trends to what they're eating, right? I've had people say, well, no matter what I eat, it really does not matter. It really does not matter. And they're really not sure that there's anything more out there that could possibly help them, after they've already kind of pulled foods out, put them back in. And sometimes that comes along with a lot of, I would say, unnecessary food restriction, which is kind of the another really important piece of this conversation where people, kind of think they may have reacted in some way to something, 5 years ago. So they cut it out, weren't really sure, but then have just never brought it in because they're afraid, because they feel so badly and they're so afraid to reintroduce it. So, I'm sure you hear really similar stories and experiences. So I'm curious to hear, as you filter through those things and those conversations, how do you approach them as a clinician? What's your kind of go-to, your top strategies for starting to make sense of things?
Well, I just want to, as you were talking, I thought of a few stories. So I just want to tell a few stories first. Good. As you mentioned, sometimes it's the littlest thing. So yesterday I was reviewing a food journal. This mom feels like she has done everything for her child for eczema. But when I'm able to look at her history, I see partially done protocols. I see partially done things. I always say to people, I kind of start to feel like a broken record. It's not that you weren't trying some of the right things. It's that you didn't try them for the right length of time in the right order, the right thing in the right order for the right length of time, basically. So something we found yesterday was that, her son had and this is really just very fine tuning. Her son was fairly reactive to coriander, right? The seed from cilantro. And she introduced a sausage that had coriander and red pepper in it. And I thought, these 2 days he had this sausage, he was itchy both times. Weird. And I didn't go over and look at the results because it had been a while since we looked at them. And I said, actually, he's a little bit reactive to this. She said, oh my gosh, I just missed it completely, right? And we start to think this little tiny thing isn't going to bother us, right? I had a guy with ulcerative colitis try to reintroduce vanilla, right? Which we have vanilla in so many things recently. And he was just super ill for a day after that. So it's kind of wild and really interesting and validating when we see how that works, right? But you're exactly right. I think the best way to think about this is who should consider getting a food sensitivity test? It's probably not the first thing, right? And the other thing is I hope we make sure we talk about this, the appropriate way to implement it, because that's the biggest part. Don't even bother if you're not going to utilize it properly. But you're right. Sometimes you get into unnecessary food restriction, or people restrict forever and ever and ever. And then they're like, well, this seems to be changing. Well, that would make a lot of sense because of the way permeability works and the way sensitivities work. They're kind of, it's information we need to use in the present. And so I like it when someone has already tried something, right? They've already tried to eliminate something, has some success, but not full success. That's a really good sign they could benefit from a test, right? Or really guided help. I think I have to be careful saying, is the test the answer, or is someone that can help you guide you through it a better answer? Because honestly, I've had to retest so many people that have had a clinician just treat them like they have allergies, right? Just go avoid these few things. I'm sorry, but that doesn't really work. It doesn't work very well. They might get a touch of relief, but there's 70,000 foods out there. Avoiding 3 or 5 doesn't really make sense. So anyway, the goal here, like you said, is not unnecessary food restriction. It's not forever food restriction whatsoever. And that's what some people start to get themselves into. So I have seen some negative spirals where people start removing things and just removing things, and they get a little bit of success, so they just keep doing it. Not that long ago, I talked to a mom. She was breastfeeding a child with eczema, and she's totally cool, really awesome woman, but just accidentally got down to less than 10 foods to eat for herself because she kept looking. She was doing so much research. And it was all so contradicting. It was making her crazy. When your child's up and itching and crying, okay, what are my answers, Dr. Google? And so she just kept eliminating foods again and again and again. And it ended up not being really the answer for her. But overall, if someone has tried to eliminate something and gotten a little bit of improvement, assuming that they did a good job of it, right? Which is always, part of the question and answer process of trying to help guide someone. Should you actually do this or not? It's really good to have that conversation with someone. Should I actually do this or not? Someone that knows what they're talking about, right? Because as you said, it's really hard for us to see some of those things on ourselves too. We do know ourselves best, but one of the things I really try to empower clients is to feel like they have ownership and control of their body. They know exactly what's causing what. That's one of the big goals, is that you don't feel out of control anymore, right? You know exactly what's causing problems. So I guess those are some of my takeaways from what you just said.
Yeah. So, thinking about food sensitivities and testing, just to kind of just go back and just summarize a little bit. When you think about adverse reactions to food, right? What could be causing you to feel gassy or bloated or causing a little bit of skin irritation after eating? It can be related to an enzyme deficiency, kind of more of a metabolic insufficiency or dysfunction of some kind, or it can be a little more, I think of it as kind of pharmacological, right? Where you might have issues with kind of histamine or tyramine, right? Different additives, sulfites. And I think when it comes to that second group, especially when it's less metabolic, some of those issues or responses can be identified through either a really well done elimination diet, And there's a number, right? A number of ways to go about it. But if you don't get the answers that you want, oftentimes going on to testing can really make a lot of sense. But I think you're right in that. I think a big distinction, and of course we're biased, right? Because we see such great results with our people, and we're trained, and we really love what we do. But I think oftentimes that working with someone can make a world of difference because, we're trained, as integrative dietitians to really be able to figure out perhaps what connects to what. And so with histamine intolerance, right, there's different things that we would be looking for as compared to lactose malabsorption, right? That's an obvious example, but a very clear one where we can kind of filter through with our clinical expertise and what we know and the reading we've done and all of that to try to just even narrow down, in a first phase, even without testing, okay, what makes sense? What makes sense to, as far as a path to go down where we might want to modify this or layer in some other things. And then see if we can move forward with that. So anything you would add to that piece just to kind of round that piece out, and we'll talk about the testing thing.
No, yeah, I would recommend people try some trial and error on their own because honestly, anything you do the first time is going to be the hardest, and so it's going to be a lot easier. Some people's results lend to very easy kind of protocols, and some people's aren't as easy, but it's much easier for the client if they've already tried something and it's not brand new to them, right? And that's kind of, because that's a whole nother thing, right? That's a whole other conversation. Like when something's brand new to someone, it's more difficult. And when you need help is when you'd like a shortcut and you don't want to just keep wondering, like, why do I still have these symptoms even though I tried removing wheat or dairy or some of the common things, right?
So takeaway point being, don't give up. If your symptoms are really confusing, don't give up because there are usually other things yet to try. So if you can work with someone, it can be done systematically. So because really you could just follow elimination diets for the rest of your life. That's what I say to people sometimes. You'd have years and years and years of uncertainty and never really get to the bottom.
Right. And symptoms. As much as those are the people that contact us or gravitate or look for people that do the things we do, my heart kind of breaks for all the people that could be helped that don't even know that this is an option.
Don't even know.
Honestly, like my sister-in-law has IBS, but she's ended up in the hospital a few times and with more significant flares. And I just think, gosh, there's so much potential for reducing that inflammation. I'll probably put a bug in her ear again this weekend when she comes to visit. But, sometimes people, it's just out of their periphery or they don't even think about it as a possibility. Yeah. And so for those people, go ahead and share this episode with them because there is so much you can do beyond maybe what your doctor has prescribed for you or told you. Because a lot of people who have IBS, they're told, well, do the FODMAP diet, which is in another conversation about how is another unnecessarily long-term diet that is really not a fix at all.
Oh, that's another episode. So. Wow. Yeah, right. Yeah, I've heard it. Gosh, it's amazing. The things, right? And we could all write books, I'm sure. But yeah, I've even heard that from a physician that food really has nothing to do with gastrointestinal symptoms or IBS. And I think, wow.
Yeah, that's hilarious, right?
Doesn't food go through there, right?
Yep. What you eat has nothing to do with what's going through your GI tract. Yep. That's absolutely not. I mean, come on, guys. It's probably because I just really wish that, I guess one of the nice things about my story is that I had to go through this myself, right? So as much as I hated having some really intense disfiguring eczema that transitioned into digestive issues, by the way. It was a blessing because as I was going through it, I thought, I'm going to be able to help clients so much better after this process, right? Because I'm really firsthand experiencing it. And so it's, not that you would wish any issues on people, but it's such a bummer because it's too bad you couldn't test some of this stuff. For those that see, I love a good open-minded doctor that when they see successes in their patients, they say, okay, what was that and how can I help other people have that same success, right? A lot of people just don't, it's not a doctor's fault. They didn't have any nutrition education training. And honestly, there's a lot of dietitians that don't really know about some of this stuff either, right? Like it's no one's fault. You just didn't have this, you don't know what you don't know.
You don't
right?
know what you don't know.
But
exactly.
you sure wish that all the GI doctors that have a lot of potential and so many people that could be really well impacted by a few food changes would do very well. I always feel better when I have a GI patient that says that they're, I remember one in particular telling me that her nurse practitioner said, oh, yeah, like she was going off of her medications. And her nurse practitioner said, oh, yeah, that's great. If more people would do food changes, we probably wouldn't need most of these medications. And I thought, oh, that's nice.
So seeing the value. Yeah, we need more of it.
Yeah.
We need more of it.
Yeah.
So let's talk a little bit about this whole process of using let's focus specifically on testing, of using food sensitivity testing to try to gain some leverage and information versus just, the common perception of having a list of foods that you now can not eat for the rest of your life, right? Mm-hmm. Like you touched on. Talk us through a little bit more about the distinction and really what a well-done protocol or process might look like if you're using the best available food sensitivity testing.
Yeah, absolutely. So one, I want to mention what the most common thing people do wrong, right?
Great,
so
yeah.
Most commonly, there's all kinds of practitioners beyond dietitians that are going to offer. There's a Facebook feed will offer you a food sensitivity test, right?
For $39,
like, anyone will give it to you.
Groupon.
Yeah, exactly. Right, exactly. Like anyone will give you one. The quality of those might be another factor, but most people view it because we're familiar with allergies and we know we avoid allergens because we perceive them to be long-term things, right? There's no real, we're not really challenging that fact, but we see allergies as a long-term thing, and it's the most commonly known food reaction, so we treat sensitivities much like food allergies, which can be a slippery slope. It can be overwhelming, and it's usually not that effective because that's really not the point. So the way maybe you or I handle food, and honestly, there's a ton of, I know lots of chiropractors that offer food sensitivity testing. They get the results. They say, okay, avoid these 10 foods and be on your way. And people will say that didn't really work, right? They might get a little bit of benefit depending on how severe or inflamed their symptoms are, right? So, but the way we like to do this is flip it upside down and say, okay, so we know you're really reactive or really sensitive or really getting a lot of inflammation from all these things that are really highly reactive. Why don't we do the opposite and start at the bottom that's most low reactive, and we'll try to wipe off your dirty windshield that is your body. So that way when a bug hits it, because we want to just add really with some guidance, we have certain things. I always say to clients, depending on your condition, I put that lens on top of this test. So if you have eczema, I'm putting that lens on top of this test. If you have this condition, I put this lens on. So anyway, so that kind of, they like to have that, what should I do? It's nice to give them that little piece. But basically start with the things that are the opposite of the opposite of inflammatory, the least inflammatory. That would be like your custom anti-inflammatory diet. And then you broaden and broaden and broaden from there, honestly. In a nutshell, that's really what it is. So you can see that this is not about unnecessary food restriction. Yes, for a very short time, it might be kind of restricted, probably not a good fit for someone who's got really disordered eating history, right? Because they kind of latch onto that a little bit. But for the average person without that problem that just has a lot of inflammation, you can get some really fabulous results, and then broaden and broaden and broaden and see what bugs hit the windshield, and then, retest those bugs later, because just because a bug hits the windshield now doesn't mean it'll always be a problem. So I would say at this point, weed can be an issue for a lot of eczema people. And so I kind of avoided it for quite a while because it was definitely, when I was really severely affected, a lot of things were affecting me. But, just recently, I would say after I don't know how long it was, but it wasn't a terribly, terribly, terribly long time. I would say I'm pretty much over that now. And I can kind of enjoy that in, worst word of the year, moderation. And what does that mean? I always say
another
it's kind
episode.
Of a teeter-totter. Yeah, no. So what I tell people is they say, well, what should I do with this long term? I'm like, just do more supportive than aggravating, right? The more you aggravate your system, the more you unravel things, but the more you support it and just kind of occasionally enjoy that. So it's really kind of fun to see how these sensitivities go away the more and more healing you do. So really equipping someone with the tools that they need long term for appropriate healing, long enough and giving them the right expectations for how long something should take, what's normal and what's not normal, is really important. Really helps guide that, really helps flex that confidence muscle, which is pretty much the most important thing. And the thing people are craving most.
I often describe the role of testing in providing clarity and just helping people to make sense of what's going on as clearing the slate for any symptoms that are related in the moment to food sensitivities, to whatever your immune system is reactive to. Because what I find is that leaves a percentage of symptoms that might be related, say, to, 5 years ago when your gallbladder was removed. So fat maldigestion, or maybe there's a little bit of, like you said, dysbiosis SIBO, which isn't totally, obviously, right, and not directly addressed by food sensitivity testing. You can have overall improvement, but residual symptoms that are still there, what I find often becomes so much clearer when you're working with a smaller group of really intelligently chosen foods, with testing done through the lens of clinical experience. And then you can help people to really address those things. That's how I think of this. Address those things, get those under control. So then you have a whole new baseline, where people feel better than they have in such a long time. And then you can build off of that. Because I tell people, once you feel so much better, 95% better, then it's going to make so much more sense, when you're introducing one or two foods at a time, what foods are causing, whether it be, symptoms related to a sensitivity type reaction or something else. We can figure it out so that you have that, knowledge to move forward with. So that is also, for me, one of the big distinctions I see between just handing somebody a list of foods or ordering something offline, right? And being like, okay, I just need to avoid these things for the rest of my life. It's very much restriction oriented versus working with a protocol where it's more about, okay, so restoring function almost, right? Becoming very clear on what's happening, trying to understand the mechanisms, and then healing. That's the ultimate goal, right? Rebuilding, so integrative the GI tract and calming the immune system down, all that good stuff.
Right. The goal is healing, right? It's not to feel like you have to live with something forever. That's not the goal. And so if someone kind of promotes that as the goal, then just keep moving on.
Keep moving on. So the thing that often surprises, so even me, sometimes I'll be honest, is the types of foods that can come back reactive. So just to say that, I personally, I'm pretty sure you do too, I'm using mediator release testing in my practice. I've had really, really good results with it. And so, sometimes foods like salmon, or turmeric, things that otherwise I would encourage regular consumption of without the testing for a standard elimination diet, come back as a little bit reactive. Do you see just confusion around that as well? And how do you approach it or describe it or handle that?
Yeah, that's kind of the advantage of doing a test, right? Like, you wouldn't think that vanilla would cause someone to be in convulsions overnight, right? Or you wouldn't expect that coriander would cause someone itching. But so, these are typically things that were not considered inflammatory. How can they be reactive, right? Well, because your gut, so really, let's get a little micro here. So your gut has tons of doors, tight gap junctions between the cells. And I always say that, okay, so if you look at the closest door to you, and if it's closed, assuming it's an interior door, you should be able to have air go underneath of it. That would be like vitamins and nutrients that would be able to, like, once food is broken down into its smallest pieces that are usable by the body, vitamins and minerals, and nutrients, that would be able to be go through the gut membrane just a little bit, those would be small enough to go through those closed doors, because they would just slip underneath, right? But what happens is sometimes these doors get opened. We don't really have to debate whether this is a real thing or not, no matter what your doctor says. You can go onto the biggest research repository, PubMed, and search for intestinal permeability and find, 3,000 or more research articles that talk about this. So it's not a concern of whether it's real. It's just maybe it's not talked about in different contexts. So anyway, these doors are open. That's what intestinal permeability is. The tight gap junctions of the doors get open. So if a door's wide open, then something much larger pieces are going to get through the door, right? Not just the vitamins and nutrients that slip under the door. And so that's kind of how I describe food sensitivities, is that depending on, and it just really depends. So some things might be a little bit of a longer term issue for some people, and some of them might be related to just a little bit of permeability or things they've been eating more often. Mm-hmm. It really depends. That's part of my initial questioning once I get results is, are these foods you eat a lot, or are these foods you hate? Sometimes it's really interesting. Sometimes someone will say, I hate that food. That might just be you really knowing yourself, right? Mm-hmm. And so we also call kids sometimes super tasters. Sometimes they know what they don't like. Mm-hmm. But basically, if the door is wide open and food's not completely digested, it can go through that door. And so you'll have like proteins going through that door. And then let's say there's a guard on the other side that's supposed to be keeping all the riffraff out. And he's supposed to say, send out alerts if there's somebody that doesn't belong in that side of the body on the other side of that membrane or that wall, basically. And so he's got all these new guys coming through that don't look familiar, right, that really haven't been digested appropriately. And he's kind of sending out mayday signals, right? And mayday signals look like these symptoms: itching, scratching, redness, sinus issues, gas, who knows, lots of those. There's pain, migraines, headaches, etc. So that's kind of what that looks like. That's how I describe it anyway, is that larger than necessary particles are getting through the other side and causing problems, right? And so for some people, food sensitivities are a godsend, and they are kind of the one thing that we need. And sometimes we need a few more pieces to kind of really wrap up this whole story, right? Mm-hmm. It's not just the only piece. And so I think it's good to mention that too, that there's a few different layers of things that can be going on that can cause that. And that's honestly some criticisms of some people, is that, you don't need food sensitivities because you just need to fix the doors. That's maybe true, but gosh, what if we could just get rid of all the symptoms first while we do that? Wouldn't that be fun? So that's kind of why I still like employing that test that kind of gives me an edge, right? Because I want quicker symptom resolution for people. I want the fastest symptom resolution, right? So that's why I still use it.
Christa, you have the greatest analogies. I love it. The guards and the doors and all of that. So yeah, but you're right. Food sensitivities are always just a piece. Like you said, for some people, pulling out a couple of foods can alleviate a huge percentage of their symptoms. But for other people, there's really 5, 6, 7, 8, 9 things, layers, you might be building in to try to address, because my gosh, when you think about gastrointestinal health, right, from just digestion and absorption to the microbiome, right, to all the immune system dynamics that are there's a lot to think about. But I'm with you in that often addressing food sensitivities, because you can get someone to a place where they feel so much better, so much more quickly, allows the whole rest of the process to just unfold with so much more ease.
Yeah.
So, yeah.
Way more fun. Way more fun when that happens, not going to lie. So, And, as someone who focuses in nutrition, it's not unusual for us to be a little biased and for us to say it's really fun. Like, we're the most equipped to do a food first approach, right?
Sure, yeah.
Honestly, better than other people doing sensitivity testing that they actually feel like food is kind of foreign, or some of this stuff. We have a lot of tools to make it a lot simpler, right?
For sure.
Or there's a lot of kind of like gray areas, like which way do you go in this gray area? Like, can I drink XYZ or whatever? Or is that going to cause an issue? So that's I guess maybe you're hitting a little bias on us. But man, it's super addictive. Those results are super addictive. So,
it is.
So I keep doing it because it still works for the majority of people.
Yeah, so. Yeah. And after a couple times where someone comes back in disbelief because for so many years they've struggled so much, like, man, it doesn't take much. It doesn't take much. So right. Good. So yeah. So
to make us excited.
You've got it. So yeah. So thinking about just pulling this all together and giving people some next steps, maybe some resources. Do you just want to talk, give us a few examples of maybe the big results or improvements that you see most often, when you kind of work through this well-informed protocol, using testing, using a combination with clinical experience and wisdom, just overall symptom improvement, and then perhaps any other guidance you'd like to give around types of food sensitivity testing, where people can go to try to get this type of help that we're talking about.
hmm So I always tell people that my overall goal when we start working together is, 50 to 75% improvement minimum, more like 80 or 90% desirable, right? And that's kind of common. I mean, that's what we really, really shoot for, right? And so the more symptoms people have initially coming in, that's great because that's more symptoms we can improve going out, right? So some of the initial things, I like to give people timelines of what things should look like, right? So I can tell them like, oh, your digestive stuff might improve really quickly. Maybe improve those first few days or first few weeks. Some of these pain things, they're going to take some tweaking. Those can be a little more latent. Those can take a couple weeks, few weeks. It just kind of depends. So, it's really nice to have a really realistic. I think sometimes we get discouraged when we don't know how long something should take and if we're on the right path. I get discouraged when I hear people doing their own protocols, doing things for months at a time or waiting days to introduce things. That hurts my heart a little bit. Like, oh gosh, it doesn't have to be so hard. We have faster, easier ways to do this. So, we see gas and bloating and all that stuff kind of disappear quite quickly if we're on the right track for things. But again, I do have to add some other agents in pretty frequently depending on that person's history. So it's really unique to that individual. So I think that's the other piece is like, okay, so sensitivities are awesome. I really, really, really love them in hugely inflammatory things. Even for someone who's kind of subclinical, I had a business owner who just felt like, I just got brain fog and, I just feel fatigued and really can't, he's just like jumping out of bed. Like he said to me, I feel like work is going at 75% and I'm operating at 100%. So that's really fun too. So I actually kind of love both ends of that spectrum, either someone who's pretty bad or someone that's just kind of subclinical, like doesn't have these diagnoses, but knows that they could perform a lot better, right? Actually, I don't know that you or I do this, but there are athletes that utilize this testing and this protocol because it helps speed up their game. Like it really improves their performance because inflammation is presenting in all of us. So, maybe the people that call are the people that are really dealing with it, but guess what? We all have inflammation. So sometimes it's really fun to work on more of a kind of a low grade case, right? And see those improvements really start to happen. So that's really fun. What was your next question, Sarah?
Yeah, I love that. So just really optimizing performance and health, right? That's just as good of a goal as reducing symptoms associated with disease, right? So I love that. I'm so glad you pointed that out. And then where can people turn? Where can people go? Because like you mentioned, when you think about food sensitivity testing, you go to Google and it would give you, how many suggestions, right? So just talk us through, next steps for people if they're intrigued by this, if they think they want to explore a little bit more. And certainly your website, a little more about you and your work and where you specialize, all that good stuff.
Sure. Yeah. So I always say, it's who you know, right? And so meeting someone or having someone come into your periphery is a really good thing. Most of my clients come to me by referral, quite frankly, or someone else, some relative found me and then they recommend it to their friend who says, oh, this is exactly what I needed. So, that's kind of interesting to me. And honestly, that's probably how I found half of my providers and things over the years too, right, is through referral. So if you're just cold searching, you can go to Integrative RD and look for someone in your area. But if you're looking, if this conversation was something you're really intrigued by and you want more information, you can certainly talk to either Sarah or I. My website is lessstressnutrition.com. So just to keep it really kind of pulled together, I have a podcast as well called The Less Stressed Life. And so lessstressedlife.com will get you there. And Less Stressed Nutrition is the private practice, the one-on-one practice. And I think my favorite thing, and I guess I'm really kind of a fan of this, is after you've worked with a lot of professionals and you've figured out what you don't like a lot, you do the opposite of that, right? And so I guess one of my favorite things, I require everyone to have kind of an intro call just to figure out if it's a good fit for people to understand, is this even the right fit for you? Because if it's not, I'm definitely going to tell you. Absolutely. I just, it's the goal to never guide you to do something that doesn't really feel like the right fit for you, or for me to just be bluntly honest and not sugarcoat things. That's a really important part. So hopefully you can find someone that'll do at least a mini intro call with you. And that's kind of how I start everyone, is helping guide them, and kind of developing their treatment plan based on that initial call. Like, what is the big deal here? Because you're going to find out a lot more just letting someone tell you their story than me sending you a long intake form, right? So that's a really valuable piece that I'm actually picking out a provider right now. And she's not, and the one I was looking at doesn't offer that intro call. And so I'm actually, my eyes are wandering. I think I'm going to try someone else instead, just because I want to know before I hang out with her for an hour and a half, right? So I like that option a lot. So so lessstressnutrition.com and lessstresslife.com if you want to come check out my podcast. Since you were already a podcast listener, I'm so honored.
Yeah, do check out Christa's podcast. Tons and tons of good information on all kinds of topics related to integrative nutrition. So always plenty to learn, plenty to dive into. So Christa, I so appreciate you sharing your perspective, which is so rich and so well informed with us over this time period here today. So I'll post everything down below the episodes. They can click through to your website. So any summary words, anything to just close us out, words of wisdom from Christa?
Yeah, I mean, honestly, the biggest thing is that this doesn't have to feel like some kind of long-term life sentence, right? I think that's kind of my big thing I want to leave you with, that you don't feel like what you've got going on is a long-term life sentence. You can always improve anything. Again, we're a little biased. I think you can improve anything with nutrition and lifestyle changes, like your periods, acne before your periods, your child's ADHD, all types of things, right? So just know that there are so many opportunities out there for you, and that nothing is really a life sentence. You can always improve the pendulum or the set point on something. And Sarah, I just have to mention, hanging out with you is like having a warm cup of tea. You're just so calming and soothing.
Well, thank you for that. I have my Trader Joe's Moroccan mint tea here, and so I'm feeling exactly like that. Like hanging out with a warm cup of tea. It's a great fall morning here in upstate New York. So, Christa, thank you again so much, and we'll talk soon. We're in a lot of the same circles. So take good care, and yes, please, anyone who's listening, feel free to reach out. Don't go it alone. You really don't need to.
Yeah.
All right. Bye-bye, Christa.
All right. Thanks so much,
You're
Sarah.
welcome. Bye-bye. Sarah here, owner of Mindfully Nourished Solutions. It's my goal with this podcast to explore strategies for empowered and well-informed food and eating decisions. If this information has been supportive to you, please head over to iTunes to rate this episode and to leave a review about what was most helpful. To learn more about how food is impacting the way you feel on a day-to-day basis, head over to my website at mindfullynourishedSolutions.com for a copy of my free food mood journal. See you next time.